Thank you for joining us today as we discuss the national regulations on appropriate use criteria for advanced diagnostic imaging. CMS is launching this program beginning in January 2020, and it has implications for both providers who order imaging for Medicare patients and for providers who perform the imaging. First, I'd like to welcome our speaker. Regan City is a healthcare quality professional with expertise in radiology quality and operational excellence. She's also a physician assistant with a clinical background in specialty procedures and urgent care.
Thank you so much, and welcome, listeners. Today I'll cover the terminology associated with appropriate use criteria, give you a bit of background on the regulations and where things are headed, provide what this means for you as the ordering provider, answer a few of your questions, and we'll end with actionable next steps. We have some new acronyms to become acquainted with, but first let's define advanced diagnostic imaging so we're all on the same page. This is comprised of 4 modalities: CT, MRI, nuclear medicine, and PET. We generally refer to these as high-tech imaging. I'll get back to the additional terms in just a few minutes. President Obama signed the Protecting Access to Medicare Act, or PAMA, in 2014. Among other rules, this mandated the use of clinical decision support when ordering advanced imaging studies for Medicare beneficiaries. Originally, this was set to begin in 2017, but there were, and most would argue there still are, several complex issues to tackle. The 2018 physician fee schedule finalized the start of the program as January 1, 2020. There are no penalties applied in this first year. It is formally called an education and operations testing period, where ordering providers are required to consult with appropriate use criteria when ordering high-tech exams for Medicare patients. Starting in January 2021, the first penalties begin. Imaging providers are at risk for having payments denied if their claim does not document the ordering provider's consultation with the appropriate use criteria. This documentation will come in the form of a decision support number that will be translated to billing codes during the claims process. The penalty for ordering providers comes later, although the pain of implementation has already begun. CMS states they will identify ordering providers as outliers compared with their peers, who will then be required to do pre-authorization. Let's come back to our new set of acronyms as we look at this at a high level. A qualified provider-led entity, or QPLE, is a group of medical professionals who create and update the imaging clinical guidelines. Think of the guidelines as the knowledge base, what CMS calls the appropriate use criteria, or AUC. This knowledge is then developed to be housed in software and presented to the user. The software is the interactive electronic tool the provider uses, what CMS calls the Qualified Clinical Decision Support Mechanism. As the ordering provider, you will interact with the software. Once you have entered clinical information about your patient, like their signs and symptoms and a diagnosis, the tool will display a numeric score of the level of appropriateness. It may also display a relative scale for the cost of the exam and the patient's exposure to ionizing radiation. Additionally, the tool may display other imaging studies to select. I'm giving you an example of this from National Decision Support Company, but by no means endorse, support, or receive compensation from anyone. This is one of 3 vendors that state they have or will have open access free tools for providers. You can find a link to all the CMS-approved clinical decision support mechanisms in the resources section just below where you found the link to this webinar on our website. The ordering provider can now choose to continue with the exam or select a different one. Once chosen, the software will create a decision support number. This is the number that must accompany the order you send to the imaging provider. Putting the whole system together, we get a feel for the complexity I mentioned earlier. All the people and all the organizations involved in obtaining an advanced diagnostic imaging study for a Medicare beneficiary. Of note, the rule is quite clear about who can and cannot consult the AUC. Someone working with you in your practice may be able to, but the imaging provider and their staff cannot. We've selected a few questions from those submitted. On slide 4, what do you mean by an outlier? Great question. The calendar year 2018 final rule stated that more information about determining outliers will come in future legislation. However, we do know CMS states that outliers will be identified using the ordering provider's NPI from claims, and that up to 5% of ordering providers may be identified as outliers and then required to obtain pre-authorization when they order high-tech studies for Medicare patients. So generally speaking, an outlier will be some individual providers who order exams that are more inappropriate compared with their peers. What is a clinical priority area, and how does CMS intend to use them? Thanks for bringing this up. CMS states they will gather data about the habits of ordering providers and their interactions with the AUC. So we're right back to talking about outliers. But CMS states they will focus the scope of their analysis on 8 areas that were defined in the 2017 calendar year rulemaking. Those 8 areas are coronary artery disease, suspected PE, headache, hip pain, low back pain, shoulder pain, lung cancer, and lastly, neck pain. In the resources section right below where you found the link to this webinar on our website, you will find more information about clinical priority areas. One last question for today. I understand for imaging centers, but what about patients in the ED? Yes. Just like with real estate, it's all about location, location, location. So keep in mind the AUC rule applies to all Part B payments for providers and facilities that furnish advanced diagnostic imaging studies in physician offices, hospital outpatient and emergency departments, ambulatory surgery centers, and independent diagnostic testing facilities. CMS has stated that exceptions to the consultation rule may apply in medical emergencies. I suggest you see the physician fee schedule to see the definition of medical emergency. Okay, so we're at the end, and now you're thinking, so what do I do next? These are my recommendations. Educate all your ordering providers. Meet with your EMR vendor as soon as possible. You are their customer, and they need to help you be compliant with this federal regulation. Think about what workflow is going to be best for your practice and involve all the team members who will help out. See if your imaging provider is ready to accept decision support numbers and where specifically on your order they should go. If you have an electronic order interface with them, this will likely require testing the messaging with your IT departments. Lastly, ask your EMR vendor about reporting and analytics. Take the opportunity to review your performance before CMS starts assigning providers as outliers so you can make sure you're not one of them. Thank you so much for your time and attention. As I mentioned, check out the resources section for helpful information and links right below where you found the link to this webinar on our website. And feel free to reach out to me directly with questions. We are truly all in this together. Take care.